Well, what is the Welsh Government doing to tackle mental health problems in young people?
Well, we're working with our partners to deliver a whole system improvement to the mental health support provided to young people, building on our successful work and investments since 2015 and delivering, of course, on our Prosperity for All commitments.
This is not the first time I've raised this subject with you, but after the recent Panorama programme on mental health provision for young people, I was inundated with messages from parents in the Rhondda who feel that their children and teenagers have been let down by the system. The programme certainly touched a nerve, First Minister. One thing that could help is for school counselling services to be improved. Now, it's a statutory requirement for secondary schools in Wales to have an in-house counsellor, but provision remains patchy according to the Children's Society. They say that some schools provide an excellent service, while some schools provide no counselling services at all. This is an area under your control, First Minister. Many children and teenagers are being failed by the health service primarily, but also they're being failed within the education system as well. So will you commit to evaluating the service to make sure that there is a high quality service, that it is good and consistently provided for all secondary school pupils right throughout the country?
Well, I'd be extremely disappointed if secondary schools weren't providing the service that they're meant to provide. I think I've said in the Chamber before how much money we put into CAMS, but I think where the emphasis has to go now and what we're looking at is what happens in that gap between the counselling services and CAMS. Many young people won't go and see a counsellor in school because it's a little bit too close to home, and people think that the people will find out about it. And many young people don't actually need the kind of medical intervention that CAMS provides. So the emphasis now is going to be on how do we provide a level of counselling service outside of school for those who would benefit from that service without having to go into CAMS. So, as far as the 2019 to 20 draft budget proposals are concerned, they do include further planned investment in CAMS, but that will be targeted at meeting the needs of those who don't need the most specialist treatment and meet the needs of that missing middle. I think that's where we have to ensure that no gap exists.